A+. If you have A+ blood, there's a hidden danger most people never hear about. Your body tends to overreact to inflammation. For A+ individuals, the immune system doesn't just respond, it often goes all in even when the problem is small. A mild cold, a simple infection, or even long-term stress can trigger a stronger reaction than your body actually needs. That's why you might feel symptoms harder, feel drained longer, or struggle more with things others recover from quickly. The danger here is that too much inflammation slowly wears your body down. It can put extra pressure on your blood vessels, affect circulation, and make you more sensitive to respiratory issues and fatigue. There's another small detail many people don't know. A+ blood tends to be just a little thicker than other types. This isn't usually a problem, but in extreme situations, dehydration, high fever, or intense physical effort, your blood flow can slow down, forcing your body to work harder. In simple terms, the real danger of A+ isn't a weak immune system. It's an immune system that pushes too hard, too fast, even when it shouldn't. A negative carries a danger most people discover only when it's already a problem. Your body is extremely picky about what blood it can receive. Because A- lacks the positive Rh factor, your immune system is quick to attack anything it sees as foreign. That protective instinct helps in some situations, but it becomes a real threat during accidents, surgeries, or emergencies. If the wrong type enters your system, even by mistake, your body can go into a severe reaction almost instantly. There's another hidden danger. A-negative individuals often have more sensitive immune responses overall. That means when a virus or bacteria hits, your system might trigger bigger inflammation than needed, leading to stronger fevers, longer recovery times, or more intense symptoms. But the most serious risk appears for women with A-negative blood during pregnancy. If the baby is Rh positive, the mother's immune system can quietly build antibodies that attack the baby's red blood cells. Today, medicine can prevent this, but without treatment, it becomes a life-threatening situation. In short, the danger of A-negative isn't just rarity. It's that your immune system is powerful, reactive, and sometimes too aggressive when faced with the wrong match.
B+ blood carries a danger that hides in your blood chemistry itself. Your red blood cells attract certain bacteria more easily than other types. Because of the B antigen on the cell's surface, some infections can stick to your blood cells faster. That doesn't mean you get sick more often. It means that when you do, symptoms can become stronger, especially stomach-related or respiratory infections. Your immune system usually fights back well, but the first phase of an infection can hit harder than people expect. There's another subtle danger. B+ blood sometimes responds differently to inflammation. Your body might hold on to inflammation longer, even after the infection is gone. That can mean longer recovery times, more fatigue, or symptoms that seem to hang around even when everything looks normal on tests. But the biggest issue for B+ shows up in emergencies. You don't have as many compatible donors as A+ or O+. So when you ever need blood fast, hospitals rely heavily on limited supplies. When units run low, B+ patients are often the first affected, not because the type is rare, but because fewer people donate it regularly. In short, the danger of B+ is biological and practical. Certain infections hit harder at the start, inflammation lasts longer, and emergency blood shortages can become seriously risky.
B-negative carries a danger that comes from one simple fact: you're extremely hard to match. And in medicine, the harder you are to match, the more vulnerable you become. Because B-negative is rare and Rh-negative, your safe donor pool is tiny. In emergencies, if hospitals don't already have your exact type on the shelf, things get dangerous fast. Even a small delay in finding compatible blood can turn a treatable situation into a life-threatening one. There's also a biological danger. The B antigen can influence how your immune system reacts to certain infections. For some bacteria and viruses, your blood creates an easier surface to attach to, meaning illnesses can start faster or hit harder before your body fights back. And just like all Rh-negative types, B-negative carries the pregnancy risk. If an Rh-negative mother carries an Rh-positive baby, her immune system can quietly build antibodies that attack the baby's blood. Modern medicine can prevent it, but without care, it becomes extremely dangerous. But the biggest hidden danger is simply this. B negative is one of the least available blood types in the world. That means shortages, longer waits, and higher medical risks, not because your blood is weak, but because it's rare. In short, B negative is strong, but the world isn't always prepared for it.
AB positive looks like the safest blood type from the outside. You can receive blood from anyone, but the real danger hides in the way your blood reacts to inflammation. Because AB plus carries all the major antigens, your immune system works differently from most people's. It's slower to notice some threats, especially early-stage infections. That delay means bacteria or viruses can spread more quietly before your body realizes something is wrong. You may not feel sick at first, and then suddenly feel very sick all at once. There's another hidden danger. AB plus individuals have a higher chance of developing thicker blood during stress, dehydration, or long periods of sitting. Your clotting system is more reactive, which can increase the risk of circulation problems, especially as you age. And here's something most AB plus carriers never think about. You depend heavily on donations from rare blood types. Even though you can receive from anyone, plasma and platelets for AB plus are not always available in large amounts. So in certain medical situations, you can still face shortages when it matters most. Emotionally and physically, AB plus people often push through symptoms longer because early warning signs stay mild until the problem grows. In short, the danger of AB plus isn't incompatibility. It's that threats can stay hidden longer before your body reacts.
AB negative is one of the rarest blood types in the world, and that rarity comes with a very real danger. The medical system simply isn't built for you. Because AB negative is so uncommon, hospitals often keep only tiny amounts of it in stock. If you ever need blood urgently, after an accident, surgery, or unexpected bleeding, doctors can't just replace it with something else. Your compatibility window is extremely small, and that makes you vulnerable in ways most people never think about. There's also a biological risk. Your blood carries the A and B antigens without the Rh factor. This mix can make your immune system react unpredictably. For some infections, your response comes late. For others, it hits all at once, creating sudden fevers, strong fatigue, or inflammation that's harder to control. And just like all Rh-negative types, AB-negative has the pregnancy danger. If a mother is Rh-negative and the baby is Rh-positive, the body can silently create antibodies that attack the baby's blood. Modern medicine can prevent it, but without treatment, it becomes extremely serious. But the biggest hidden danger is practical, not biological. The world runs out of AB-negative faster than almost anything else. Even a small shortage can make life-saving care impossible to deliver quickly. In short, AB-negative is powerful and unique, but its rarity makes every medical emergency more dangerous than it should be.
O-positive is the most common blood type in the world, and that's exactly where its hidden danger comes from. Everyone needs it. Because O-positive can be used for any Rh-positive patient, hospitals burn through it faster than any other type. That means O+ carriers face a strange risk. Your blood is always in demand, but not always available when you need it. During big emergencies, natural disasters, or hospital shortages, O+ is the first to run out, leaving millions of people vulnerable at the same time. There's also a biological danger specific to O types. Your red blood cells have exposed surfaces that some infections attach to more easily. Certain stomach viruses and cholera-like bacteria can hit O+ individuals harder and faster because they latch on before your immune system reacts. Another hidden issue is your clotting pattern. O+ tends to have naturally lower clotting factors. That's good for preventing dangerous clots, but risky during surgeries, injuries, or heavy bleeding, where your body may take longer to stop blood loss. And socially, O+ people often assume they're safe because their type is common, but being common doesn't protect you. It actually makes you more dependent on constant donations from other O+ carriers. In short,
The danger of O+ is silent and practical. Your blood saves almost everyone, but shortages hit you first. O negative. This blood type is called the universal donor, but that title hides its biggest danger. You can give to everyone, but almost no one can give to you. In emergencies, doctors grab O negative first for newborns, trauma patients, and anyone whose blood type is unknown. Your blood is treated like medical lifesaver, but that also means O negative supplies disappear faster than any other Rh negative type. So the hidden danger is this: when you need blood, hospitals might not have any left. Your donor pool is tiny, and shortages happen constantly around the world. There's also a biological risk shared by all O types. Your blood cells have exposed surfaces that some bacteria and viruses attach to easily. This makes O-negative individuals more likely to experience stronger symptoms from certain gut infections and dehydration-related illnesses. And for O-negative mothers, the Rh-negative factor introduces another serious danger. If the baby is Rh positive, the mother's immune system can quietly create antibodies that attack the baby's red blood cells. Without modern treatment, this used to be life-threatening. But the biggest danger is simply how rare and essential O-negative blood is. Everyone depends on you, but you depend on a very small group of donors who often don't donate enough. In short, the risk of O-negative isn't biological alone. It's that the world needs your blood more than it can replace it. Every blood type carries dangers most people never think about. Understanding yours doesn't just protect you, it helps you protect the people around you. If you want more simple explanations like this, feel free to subscribe so you don't miss the next one.